Hello everyone and welcome to Mountain Lake Journal. I'm Tom Halleck. 2 years ago this week, life here in the North Country across much of New York and the nation was stopped in its tracks by COVID-19 and the beginning of a pandemic that in many ways changed life as we know it, claiming thousands of lives here in New York and nearly 1 million nationwide. 2 years later, what we have endured, what we have learned, and are we better prepared to face the next pandemic?
This is, we use the word disruption. It's such a clinical antiseptic word. It's a period of disruption. Life is turned upside down, and it's all chaotic, and things are flying all over, and there's new information, and there's mixed information, and people don't know what to do, and businesses are closing, and the rules change every minute, and can I go out, can I not go out, how do I get the virus, how do I not get the virus? And now I'm at home, and I'm stuck at home, and the kids are at home.
This was then Governor Andrew Cuomo on St. Patrick's Day 2020, with what was then dozens of confirmed cases of the coronavirus in New York State, including the very first in the North Country. The World Health Organization had declared the COVID-19 outbreak a global pandemic, and the governor ordered a lockdown, closing non-essential businesses, stores, and restaurants like SIP in downtown Plattsburgh, which took all of its food and cooked up meals that they then delivered to healthcare workers at the hospital.
I know we have a lot of customers that work at CVPH. I know that they're doing long extended hours, and to be able to just say thank you.
Teams of teachers, staff, and volunteers jumped into action in Elizabethtown, preparing and delivering meals to kids and their families who would be spending the next several weeks learning remotely at home.
How many on the last box?
Right now, today, we are getting the bags together to go out to the families that are part of the Mountain View, Boquet Valley Central School.
Coming through. These kids, need these things, and it's definitely a lot to get out.
There's many children and families in need at this time. Because of money, because of losing their jobs, not having both parents working. So this gives them food to fall back on to make sure their children are being fed.
Even if you forget about what's currently going on, we have a pretty high need population, that heavily relies on our free breakfast and lunch program regularly. So you combine that with the current situation where, likely this was the best meal of the day that they were getting. We're now able to bring that home to them.
I can tell you that I never thought being a food service helper, being known as like the lunch lady or this and that I would ever be an essential worker. Nobody thinks of that. You're just in the cafeteria, you're doing this, and, it's surprising, but it's helpful because, some of my family members and stuff have been laid off.
80K Action volunteers and the Hub on the Hill packed tens of thousands of emergency food boxes that helped feed families for several weeks until they could return to work.
The Emergency Food Packages Project is designed to help people that are facing food insecurity because of COVID-19 get access to fresh food. And we're really trying to target people who've either lost their job because of COVID-19 or who cannot safely leave the home to shop.
We met some of the many dedicated healthcare workers working around the clock to keep patients and their coworkers safe, including Josh Wilson and Erica Stacy, who talked about their critically important job of sanitizing every surface in the emergency room.
So we work basically in infection control, so keeping the spread of germs down to a minimum.
We also met grieving families like Dawn Puryear's daughters who lost their mother a month into the pandemic.
We had no idea it was COVID until she was in the hospital.
April 3rd, she called me saying she was having a hard time breathing, that she was told she had bronchitis. I brought her here for 5 days, which was until April 7th when that night she was turning blue and we had to call 911 because I couldn't get her oxygen up and she was in respiratory distress, and within 2 hours she was in ICU and the doctors are like, yeah, we're pretty sure it's COVID.
An ambulance brought her to the hospital that Tuesday night and she never left. Doctors hadn't seen any improvement in her condition during her 15 days in the ICU.
And she's always said she doesn't want to live on tubes, she doesn't want to live on a machine, she doesn't want to live in a hospital forever. And it was a hard decision. I think, even 3 days later, we're still brokenhearted that we had to make that decision.
The doctors were like, she's not going to survive this. There is absolutely no way she will survive this.
The hospital allowed the daughters into their mother's room the day she died to say their final goodbyes.
I'd like to think that she heard everything, that she was able to hear her sisters tell her that they loved her. I'm hoping she felt me holding her hand and caressing her and being there for her last few minutes.
We also met Christina Perry, a traveling nurse from Plattsburgh who was among the hospital workers in New York City, getting nightly standing ovations from neighbors at shift change.
And they stand on their balcony and they cheer. They hit pots and pans.
And that inspired others, including a pastor in the Adirondacks.
You see all these people hanging out windows, beating pots and pans and screaming and hooting and hollering, and I was just moved by it. So I said, we should do something like that. And I looked at the boys and I said, we got a bell. Why don't we ring the bell?
And so they have. Every night at 7, Pastor Scotty Matthews and his twin boys have taken turns ringing the 1825 bell in the tower of the Bolton Community Church.
So it brings some sense of hope and joy, if you will, out of this bleak situation that we are having.
Mobile drive-through test sites like this one in Tupper Lake helped the state gather numbers that led to the phased-in reopening of restaurants and other businesses over the summer.
As of right now, anybody that wants a test can get a test. If you're symptomatic, if you're asymptomatic, we can and will test anybody that wants a test.
After being closed for 3 months, schools were allowed to hold socially distanced graduation ceremonies.
We go first? We go first to show them where to go. And 6 feet apart.
I haven't seen half these kids in months, and so it's really exciting. I'm so happy.
Other summer and fall events and traditions were also scaled back dramatically.
Everyone was tested when we got here, and we're screened every day.
Then in early 2021 came the breakthrough, the first vaccines given out by the thousands to cars that lined up 7 days a week at this mass vaccination site at the Plattsburgh Airport.
Probably the largest mobilization ever in New York State, directed by Governor Cuomo, of resources to fight this, deadly virus.
The vaccination rates climbed, leading to a loosening of restrictions and a return of high school sports. But others remained in place, like the closing of the northern border to non-essential traffic.
The restrictions that we've seen in place for the past year have pretty much been unprecedented.
It's been difficult because we are used to crossing that border easily, to go shopping, to visit family and friends, to go to events in Montreal or some of the small border towns, and of course we have not been able to go.
Janet McFetridge, who is the mayor of the village of Champlain, says people who live on or near the border are used to crossing it almost daily. Grab a cup of coffee, go shopping, or head to Montreal.
And it goes both ways. As much as we want them to come see us and interact with us, we look forward to going to Quebec.
The loss of traffic has been a blow to the economy.
And this is your first dose, correct?
Pop-up clinics continue to get shots in arms and more people vaccinated. But the Omicron surge around the holidays brought record numbers of COVID cases that finally last month began to drop. A dramatic decline into March led 2 weeks ago to the state and governor lifting the mask requirement for schools that had been in place since the beginning of the pandemic.
Given the decline in our rates, our hospitalization, strong vaccination rates, and the CDC guidance, my friends, the day has come.
Which they celebrated in Ticonderoga, with school administrators and county health department workers turning out bright and early, lining the sidewalks to greet students as they stepped off the bus at Ticonderoga Elementary.
I feel happy. I was really excited for this day. I hate masks, so I'm gonna stop wearing them.
For the first time in 2 years, New York students could enter their school buildings with the option to mask up or not.
I consider this a pandemic milestone.
Let's see the smile.
Students and staff can still choose to wear a mask. Testing, quarantining, and social distancing will stick around, and masks could come back if the county sees another spike in the number of cases.
I think everybody's a little bit anxious, but also relieved in some ways. They see this as the first step towards normalcy.
And many parents agree and say it's a big step toward getting things back to normal.
I think they've lost a lot over the past 2.5 years coming to school without being able to properly communicate. So I think everybody will be happy.